Rachel Palmer, cranial nerve 1 through 12 examination. The date is 6/21/17. Okay, we're going to start with cranial nerve 1, sense of smell. So I'm going to have you plug one nostril and inhale. Okay, and plug the other nostril and inhale. All right, I'm going to have you close both eyes now. Plug one nostril and inhale. Exhale. Plug the other nostril. Inhale and exhale. All right, you can open your eyes. Could you identify the scent?
Coffee.
Okay, was the intensity the same from side to side?
Yes.
Awesome. Okay, we're going to do some endoscopy now. Get this light turned off. Okay. Can I have you look at the corner of that picture frame up there? So I'm just looking for AV nicking, hemorrhaging, or papilledema. Also looking at the cup to disc ratio. Looks good. Can I have you look at the corner up there? Once again on this side, looking for AV nicking and the light's dying. That's okay. There's the other one right here. Okay, looking for AV nicking, hemorrhaging, papilledema, cup to disc ratio. So that looks good. Okay. We're going to move on to field of vision. So I'm going to have you just look right here. I'm going to hold up a 1 or a 2 or a 5. Let me know what you see. Can I have you cover one eye?
1, 5, 5, 1, 5, 1,
Can I have you cover the other eye now?
1, 1, 5, 1, 5, 5.
Okay. We're going to move on to direct and consensual. So I'm going to have you just look straight ahead. I'm looking for both eyes to constrict when I shine the light in one of them. Some abnormal findings would be if I shine the light in her left eye and both eyes constricted, and then I shine the light in her right eye and neither eye constricted, I would suspect a cranial nerve 2 lesion on the right. If I were to shine the light in her left eye and it did not constrict, but the right eye constricted, and then I shine the light in the right eye and it did constrict again and the left eye didn't once again, I would suspect a cranial nerve 3 lesion on her left. So I'm going to move on to pupillary fatigue. I'm going to have you still looking straight ahead. So I'm looking for her eye to constrict and hold. Some abnormal findings would be the eye doesn't constrict at all, the eye constricts but doesn't hold, or hippus, which is just oscillations. Okay, have you still looking straight ahead? Looking for ptosis. So don't see anything. Can I have you close your eyes lightly? There's some slight bilateral blepharospasm. Okay, I'm going to go ahead and open your eyes. We're going to do convergence and accommodation now. So I'm going to have you look at my finger and follow it in with your eyes. I'm just making sure her eyes are tracking together. Alright, can I have you look at my finger and then look at the wall behind? Look at my finger, look at the wall, and look at my finger, and look at the wall. Okay. We're going to move on to H in space. Have you just follow my finger with your eyes. See when she starts converging and back off a little bit. Okay. Once again, just follow my finger with your eyes. So making sure her eyes are tracking properly together. Also looking for end range nystagmus, any saccades, or fatigue. Move on to cranial nerve 5, sensory. So I'm using this pinwheel on your face. Kind of have the back of your hand. I'll show you what it's going to feel like. It's going to feel just like that. So, to start here. Was the intensity the same throughout? Was the intensity the same throughout?
Yes.
Was the intensity the same from side to side?
Yes.
Was the intensity the same throughout? Was the intensity the same throughout? Was the intensity the same from side to side?
Yes.
Was the intensity the same throughout?
Yes.
Was the intensity the same throughout?
Yes.
Was the intensity the same from side to side?
Yes.
We're going to do the same thing with pocket ball. Was the intensity the same throughout? Was the intensity the same throughout? Was the intensity the same from side to side?
Yes.
Was the intensity the same throughout?
Yes.
Was the intensity the same throughout?
Yes.
Was the intensity the same from side to side?
Yes.
Was the intensity the same throughout? Was the intensity the same throughout?
Yes.
Was the intensity the same from side to side?
Yes.
Okay, I'm gonna have you clench your jaw. Okay, and relax, and clench again. Okay, can I have you open your jaw? Awesome, thank you. Okay, number 7. So I'm gonna have you squint your eyes tight, really tight. Good job. And raise your eyebrows, and puff up your cheeks, and smile, and think of the funniest thing you've heard all day. Okay, awesome. All right, we're gonna move on to hearing. So I'm gonna have you close your eyes, and can you hear this? Let me know when you can no longer hear it.
No.
Okay. Can you hear this? Let me know when you can no longer hear it.
No.
Okay, they were pretty even. If they were abnormal, I would move on to the Weber test. So we'll go ahead and do that. Can you hear this?
Yes.
Is the intensity the same on both sides?
No, it's louder on this side.
Okay, so we move on to the Renee test. So I'm going over here. Can you hear this?
Yes.
Let me know when it stops.
No.
Okay, can you hear this? Let me know when it stops.
No.
Okay, so since air conduction was greater than bone conduction, I would suspect a neurosensory deficit on her left side. If bone conduction was greater than air conduction, then I would suspect a conduction deficit on her right side. All right, can I have you stand up over here now? So have you do is you're just gonna walk this way, heel to toe, have you look straight ahead, keep your arms to your side, I'll be right here in case you get a little wobbly or anything. Okay, that looks good. Have you back on up. Okay, this time, same thing, have you close your eyes, heel to toe, keep your arms to your side, I'm right here in case you get wobbly. Okay, that's all right. You can go ahead and open your eyes now. Sit back down. Have you look straight ahead, looking for resting nystagmus? Which I don't see anything. Okay. Just gonna move on to tongue. Nerve 12, have you just open your mouth and relax your tongue. I'm looking for atrophy and fasciculations, which I don't see anything. All right, can I have you stick your tongue out? All right, I'm looking for the tongue to deviate. If it were to deviate to the right, I would suspect a cranial nerve 12 lesion on the right. And have you push your tongue into your cheek. And resist. And push your tongue to the other cheek and resist. Good job. Okay. Now we're going to go to palate elevation. So have you open your mouth and just repeat after me. Ah, 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 ah. All right. So her palate was elevating evenly. If it was a physiological lesion, I would suspect that the side with the lesion, the palate wouldn't elevate as much, or it wouldn't elevate at all, or it would elevate and fatigue, wouldn't hold it. If there's an ablative lesion, the palate with the side of the lesion wouldn't elevate at all, and then the uvula would deviate to the strong side. Okay, we're going to move on to gag reflex. I'm going to have you open your mouth. Cranial nerve 11, can I have you bring your shoulders up and resist? Good job. And turn your head to the right. And turn your head to the left. Okay. And that completes the cranial nerve examination.